Hello, my name is Debbie Jarvis. I'm the Director of Court Services for the 17th Judicial Courts in Winnebago County. The Winnebago Department of Court Services has received funding through the Winnebago County Community Mental Health Board to develop, enhance, and expand the behavioral health services available to our clients. I'd like to share with you a little bit of information about court services and what things we have been able to accomplish through the funding and support of the Mental Health Board. The Department of Court Services is part of the 17th Judicial Circuit Courts and is comprised of 5 different divisions. Each division operates under the direction of the Chief Judge and by statutory authority provides services to the courts and those clients involved in the criminal court system. Court Services strives to promote community safety, reduce recidivism, and improve the quality of life for offenders by incorporating core values of integrity, respect, accountability, fairness, and professionalism. The Juvenile Probation Department is one of the divisions of the Court Services Department. The Winnebago County Juvenile Probation Division aims to create a safer community by addressing the problem of delinquency, of which mental health plays a role. Taryn Marco is a Deputy Director of Juvenile Probation, and she will explain a little bit about juvenile probation and the new programming developed as a result of our funding through the Mental Health Board.
The mission of the Juvenile Probation Department is to impose accountability for violations of the law, equip offenders with the competencies to live responsibly and productively, assist in the reparation of victims, and ensure the protection of the community. Offenders under the age of 18 are referred to our department by law enforcement agencies and can remain under the jurisdiction of the juvenile court until the age of 21. Juvenile probation officers utilize risk assessment tools to identify the risk and needs for each juvenile placed on probation or supervision. Officers then develop a case plan with each youth, providing the most intensive level of service for the high-risk kids. Funding from the Mental Health Board allowed us to develop and initiate our Juvenile Resource Intervention Center, the JRIC. The JRIC has contracted with a service provider to offer on-site therapeutic services to our youth, as well as provide crisis response to kids in our Juvenile Assessment Center. Our JRIC therapist receives referrals from our juvenile probation officers who have identified youth that may benefit from individual or group therapy. Once referred, the therapist will complete an assessment with the youth and develop a treatment plan with the probation officer. The youth may be referred for individual therapeutic sessions or group sessions, such as seeking safety or dialectic behavior therapy, DBT. To accommodate a school year schedule, the therapist works both afternoon and evenings, meeting the individual needs of our population on their time frame. The therapist also assists youth in crisis to help to de-escalate and determine the appropriate level of care for youth in a current mental health crisis. In 6 months of operations, we were able to serve 29 youth on probation without a wait list and assist them with the additional support of the JRIC. Through this implementation, we have been able to offer a judgment-free zone for our clients to work through any issues they may be dealing with. The therapist is beginning to help them break the stigma of being a juvenile on probation and help change that negative narrative of being court involved by offering them a safe space to learn and grow. The therapist works through crisis situations with the clients to help give them the help they need during that time of need. Keep in mind that this looks different for each youth. Success here ranges from the acute high level of a suicidal youth requiring immediate intervention, on-site assessments, and support to engage into those services with local healthcare providers. Success also is teaching skills and tools to recognize intrusive thoughts and how to use distraction to help when that occurs. One client is working on accountability, using a checklist to remind himself what he needs to do, but also to reward himself for completing tasks. Another client received the support from the therapist and probation officer to get into a bilingual program to work toward her educational goals in her native language, helping her feel comfortable in the learning environment. We are incredibly grateful for the voters in Winnebago County for supporting the half-cent sales tax, allowing the development of our JRIC, and to expand therapeutic services and programming for our juvenile population.
Another division of court services is our Juvenile Detention Center. The Detention Center is a secure 48-bed facility housing minors between the ages of 10 and 20 who are awaiting proceedings in juvenile and some circumstances adult court. The Detention Center was built in 1992 and expanded to its current capacity in 1995. The Detention Center provides a variety of programming for the minors lodged there. Julie McCrae Grotto is the superintendent of the detention facility, and she will provide additional information regarding the services and the programming made available to detained youth through the funding from the Mental Health Board.
Funding from the Mental Health Board allowed us to fill a gap that had existed for behavioral health services for our detained youth. We were able to hire 3 full-time mental health clinicians to provide assessment and interventions for minors who were experiencing crisis and facilitate programming for youth in the facility 7 days per week. This has allowed us to reach 214 youth in 8 months who had previously had limited access to mental health services while incarcerated. The therapists provide group therapy sessions several days a week, utilizing cognitive behavior therapy to help address a youth's unhelpful or unhealthy ways of thinking, feeling, or behaving. Therapists facilitate a seeking safety group, which is an evidence-based, present-focused counseling model to help youth attain safety from trauma and or addiction. One foundational goal for our juvenile detention center is to reduce isolation time for our juveniles. The youth within our facility often have difficulties regulating their emotions and controlling their behaviors, which can lead to physical aggression and or behavioral problems. The therapists are utilized by staff during those times of which crisis to de-escalate the situation reduces the time juveniles remain detained for their own safety and the safety of others. The therapists work in conjunction with qualified community service providers who provide psychiatric care for youth within the facility. Once a youth is identified as possibly needing psychiatric services, therapists work collaboratively with community service providers to arrange telehealth services. One example of a success story here at juvenile detention involves the behavioral health clinicians who have assisted in situations which a youth has threatened self-harm and have worked one-on-one with the youth to refocus their thoughts. Youth are then able to use their coping skills learned from the behavioral health clinicians to assist in day-to-day situations. Thank you to the voters of Winnebago County for supporting the half-cent sales tax, to which allows us the opportunity to increase our behavioral health services and therapeutic programming for the youth in juvenile detention.
The Adult Probation Department is another division of court services. This division strives to service the court, reduce recidivism, facilitate positive change, and promote community safety in Winnebago County. Probation officers are able to accomplish this mission through skilled and targeted supervision of adult justice-involved individuals in collaboration with community service providers and our Resource Intervention Center, also known as the RIC. Jody Drew is the Deputy Director of the RIC, and she'll provide additional information about the RIC.
The Resource Intervention Center, also known as the RIC, is a one-stop shop for interventions and treatment. Our mission is to enhance community safety by providing evidence-based targeted interventions. RIC probation officers and service providers from the community are co-located to deliver evidence-based coordinated services to individuals on probation or pretrial supervision in Winnebago County. Funding provided through the Mental Health Board will allow us to expand service hours and behavioral health services offered through the Resource Intervention Center by hiring a therapist to provide 2 additional therapeutic interventions: dialectical behavioral therapy and seeking safety. Seeking safety is a present-focused therapy that helps clients attain safety from trauma, substance use disorder, and or post-traumatic stress disorder by emphasizing coping skills, grounding techniques, and education. Dialectical behavioral therapy, also known as DBT, is a structured program designed to provide skills for managing intense emotions and negotiating social relationships. DBT incorporates many of the techniques of cognitive behavioral therapy, which helps participants understand how thoughts affect emotions and behavior. The therapist will also increase the availability of individual therapeutic sessions offered at the RIC during the day and also into the evening hours. We want to thank the Winnebago County voters for supporting the half-cent sales tax, affording us this opportunity to provide these additional behavioral health services to meet the needs of those we serve and also to continue on with our mission. We are grateful for your continued support.